Good afternoon. Thanks to Governor Little for this opportunity to address the impacts of COVID-19, which is far more deadly than the typical seasonal flu in our great state. My name is Andy Wilper. I'm a physician and internal medicine specialist by training and the chief of staff at the Boise VA Hospital, where I've worked for over a decade. I'm also a fourth-generation Idahoan. I grew up here in Boise, Caldwell, and Moscow, and have family across the state from Grangeville, Twin Falls, and Burley to Pocatello. Many of my family members and ancestors served in the United States military. I'm here to advocate for our veteran patients and healthcare workers at the Boise VA and to ask Idahoans to come together to help stop the spread of COVID-19. The Boise VA serves veterans from eastern Idaho and southern Oregon, from eastern Oregon and southern Idaho, all the way from Burns to Salmon. Tens of thousands of veterans receive care through our hospital and clinic systems. These men and women who have sacrificed their freedom and lives for their country need your help. We have unchecked spread of COVID-19 in Idaho. Presently, there is an outbreak of the disease at the Idaho State Veterans Home and record numbers of patients admitted to our acute care hospital that are threatening our ability to maintain hospital operations. This outbreak has become so pronounced that we are working with our regional and national partners to identify healthcare workers to travel to Boise to help care for our patients. Some facts about the virus. The fatality rate of COVID-19 is several-fold higher than the seasonal flu, and infection can lead to persisting illness, including among the young and healthy. After infection, it is unclear how long protective immunity lasts, and COVID-19 is capable of reinfecting people who have already had the disease, but the frequency of that incidence is unknown. COVID is real, deadly for some, and good studies show that masks help prevent its spread. Sadly, 4,000 veterans in the United States have died from COVID-19, as have scores of employees of the United States Departments of Veterans Affairs who care for our patients. Remarkably, up to 50% of those infected with COVID-19 are unaware of their infection and can spread it to others during the asymptomatic period. COVID-19 patients can take up to 7 days before they become symptomatic, but they can spread the disease 2 to 4 days before symptoms arise. And those 2 days before those symptoms arise is when they can be the most contagious. Masks not only reduce the spread of the disease, but can reduce the infectiousness of an exposure, potentially resulting in a less severe disease for people who catch COVID. In the United States, we are entering into the third wave of the pandemic, where we may see up to 250,000 cases per day across the U.S. by midwinter. COVID-19 so far has killed more people in the United States than the past 5 flu seasons combined. Soon we will have more dead due to COVID-19 than combat deaths in World War II. 1 in 10 Idahoans is a veteran. Tens of thousands of vets receive their medical care through the Department of Veterans Affairs in our state, including at the Boise VA Hospital. 1/3 of our staff at our hospital are veterans themselves. This spreading infection not only means filled inpatient beds, but also closed clinics with staff and patients on home quarantine, interrupting and delaying medical care. Our healthcare workforce is incredibly dedicated to veterans. We strive to embody the principles of integrity, commitment, advocacy, respect, and excellence to deliver the best possible care always. The spreading infection puts them, our employees, at risk, not only to burnout, but also to catching the infection themselves. VA hospitals do not operate in a vacuum. Here in Boise and across the state, all hospitals work together to get patients the care they need. We rely on services being available with our community partners to take the best care of our vets. My grandmother in Twin Falls is currently on a 1-month lockdown in her living facility due to COVID-19. Her husband, my grandfather, is now deceased. He was a veteran, and millions of veterans like him sacrificed their freedom, future health, and sometimes their lives to protect the freedoms that we cherish in the United States. We are in a battle with COVID-19, and we cannot surrender to this virus. In Idaho, we must recognize that our actions or lack of action will result in the infection and death of our countrymen. Our veterans sacrificed for our country. We can beat COVID-19 and return to normal through cooperation and sacrifice to help keep our veterans and community members safe. These men and women are special people, our veterans. They're not just part of American history, but part of world history. They have done things like pilot helicopters through burning oil fields in Kuwait, ride tanks through tanks through the streets of Khe Sanh. They've treated and operated on orphaned Iraqi children and have felt the sun and sand of the Pacific Islands on their skin. They've been awarded medals and ribbons like the Silver Star and Purple Heart, and they've liberated people from oppression and tyranny across the globe. They are our mothers and fathers, brothers and sisters, and today many of them are elderly. They are at risk from a new enemy, an enemy that is killing hundreds of Americans every day. The rights and freedoms we have in this country were earned and paid for through the sacrifice of those who served in the U.S. military. We live in a country where you can choose whether to wear a mask because someone was willing to die for you to have that freedom. That same person who helped to protect that right needs your help protecting them. They need you to choose to do the thing that may be uncomfortable for you. They need you to do the thing that may be an inconvenient burden for your life, but to not mistake an inconvenience for oppression. They need us to do this for them, not because we must, but because we choose to. Our veterans have demonstrated loyalty to our great nation by putting their lives on the line to protect our freedoms. Let us demonstrate loyalty to them and demonstrate our respect for the sanctity of their lives by washing our hands, wearing masks, and avoiding large groups while we work toward a vaccine and better treatments for this disease. Thank you.